Hi, my name is Nick Rabinowitz, and I've got one thing I want to say to you. Fast! Don't worry, I'm not saying you mustn't eat. It is very important to eat. Please eat, unless you're Muslim and it's Ramadan, or Jewish and it's Yom Kippur. But first, here's a 4-letter word that could save the life of someone you love. F-A-S-T. Fast! And it's the key to recognizing and reacting to a medical emergency that could have seriously debilitating consequences if left untreated. In fact, it could even kill you. That's right, a stroke is a serious business. Every 5 minutes, someone in South Africa has a stroke, of which 1 in 4 of those people will die. That's about 60 people who die from a stroke every single day. What may be even worse is that everyday strokes cause life-changing disabilities in about 100 South Africans. Just happened right now, somewhere. If you see these symptoms developing, facial drooping, limp arm, interrupted speech, you could be seeing the onset of a stroke, and that means you need to get medical help fast, because every minute counts.
Stroke is serious business indeed. Now, according to the World Health Organization, stroke is the 2nd leading cause of death for people above the age of 60 years and the 5th leading cause in people aged between the age 15 and 59. Now, worldwide, 15 million people suffer a stroke each year, and of those, nearly 6 million of them die from the stroke. It is estimated that if the current trends continue, by 2030, there'll be 20 million deaths annually and 70 million survivors. Now, in South Africa, it is roughly estimated that 150,000 people suffer a stroke annually, and of these, 25,000 unfortunately die from the stroke. And the sad part of this is that stroke is, to some great extent, preventable and treatable. Now, today is World Stroke Day, and the focus of our show is on stroke. We have an esteemed expert panel comprised of a consultant neurosurgeon from Groote Schuur Hospital in Cape Town, head of emergency medicine at Wits University, an occupational therapist, and a speech therapist from Groote Schuur Hospital in Pretoria. Now, with the help of these experts, we'll understand what stroke is, how it occurs, why it occurs, how we can prevent it, what to do when you suspect that someone might be having a stroke, and what treatment and rehabilitation options are there for stroke survivors. So sit back, relax, and learn from this exciting show ahead. Call us with your questions or views on Johannesburg 714-6841, 6842, or 6843. You can also tweet us at SABC Health Talk, or simply interact with us on our Facebook page, SABC Health Talk. I'm Dr. Sello Mutaung, and this is Health Talk.
"11 months ago, 23-year-old Vaughan, who was a heroin addict at the time, suffered a stroke.
I was at my mom's house in Joburg, and I had a stroke, and she thought that I was out from drugs.
She just assumed he was asleep until late afternoon. She realised she just couldn't wake him up. Called the paramedics.
Vaughan was rushed to hospital.
He'd had 2 strokes, but kicked off by the excessive use of heroin on the Wednesday or the Thursday.
I thought that it only happened to older people.
It's meant relearning how to walk and talk again.
He was in a wheelchair, and that was up until Christmas. Then we got him a stick, and then shortly after that he was walking. Not walking well, but walking, and his walking has just improved and improved.
To spell and that was really difficult. Driving is difficult.
But as difficult as the road to recovery has been, in a strange twist of fate, it's been a blessing in disguise.
He's no longer on drugs. Before it used to be quite a merry jawler.
Frightened me, you know. Having a stroke really was like, okay, you know, drugs obviously do harm, you know.
The alternative was to be dead, and if he was to use drugs now, he would die.
Eventually, you either had a stroke or something physical wrong with you, or you end up on the streets, you know. But yeah, it's not, the end of the road is always a bad thing.
Now, here to tell us about that serious business of stroke, it's a great pleasure for me to welcome in the Johannesburg studio Dr. Feroza Mutara. Now, Dr. Mutara is Head of Emergency Medicine at Wits University and also Head of Emergency Unit at Charlotte Maxake. Welcome to Health Talk, Dr.
Morning.
Mutara.
Thanks for having me.
All right. And in our Cape Town studio, we have Professor David Lefevre. Dr. Lefevre, Prof. Lefevre is a consultant neurosurgeon at Groote Schuur Hospital and UCT Private Academic Hospital in Cape Town. Welcome to Health Talk, Prof.
Morning. Thank you for allowing me to participate.
Okay, docs. Perhaps let's start here with you, Dr. Mutara. What is stroke?
Okay, so essentially, in the simplest way I can explain it to you, it's a brain attack. Like you would have a heart attack, you have a brain attack. So what happens is you have a blockage in one of the arteries that supply the brain, which then leads to a lack of oxygen and nutrients to that area of the brain and the death of that tissue. There are two types of strokes. You can have what we call an ischemic stroke, which occurs as a result of either a clot or a blockage in that artery, or a hemorrhagic stroke, which is as a result of a bleed. And both those result in death or loss of that tissue.
All right. Let's invite comment from Prof. Lefevre. Now, Prof, we just heard about the two types of strokes, the hemorrhagic and the embolic type of stroke. Can you perhaps just take us through in a bit more detail as to what actually happens in these two types of strokes?
So I think it's important to understand that 85% of strokes land up being what we call thromboembolic. In other words, a vessel is closed. Whereas the other 15% tend to be the hemorrhagic strokes, which are bleeds. So in the bleeds, that bleed can either be because of raised blood pressure causing a hypertensive bleed, in which case you get bleeding into the brain itself, or you can have what we call a subarachnoid bleed, which is a bleed from an aneurysm on one of the blood vessels. But 85% of the time, strokes are caused by blockages of vessels. And those are the ones that we see more commonly, and we tend to want to intervene with in hospital. Okay,
talk about seeing them more commonly now. Let's talk a bit about the prevalence. I mean, and incidence, I suppose. I shared some figures earlier. Do we know exactly, the extent of this problem in our country?
We definitely don't, and I'll tell you why. Because a lot of the time patients present to rural day hospitals with headaches, and sometimes then headaches are common, but they are missing people who've had bleeds inside their heads, subarachnoid hemorrhages, intraparenchymal bleeds. The other thing is, a lot of the time the perspective is that if you have a stroke and you land up at a day hospital, there's nothing that can be done. And so what often happens is when granny or grandpa has another stroke, they don't even take granny or grandpa to the day hospital anymore. I'm not implying that only old people get strokes, but I'm just saying that it's not clear to us exactly what the incidence is. We know that the incidence of ischemic strokes is probably about 250 per 100,000, and certainly subarachnoid hemorrhages is probably about 15 per 100,000.
All right, Dr. Mutara, I mean, yes, we're talking about different types of strokes and so on, but how can people watching this program know that this is a stroke? What are the typical signs and symptoms?
Okay, so as you saw with your initial video clip, the easiest way of becoming aware of something going wrong in terms of stroke symptoms is FAST. And what that stands for is focal facial abnormality. So you say to the person, smile or show me your teeth, and if there's drooping on one side of the face, that's one of the symptoms. Arms, you ask them to lift both their arms. If there's a droop or a lag of one of the arms, that's another symptom. And speech. So if there's slurred speech, or there's difficulty pronouncing words, or there's some confusion in terms of what's being said. And the T is essentially time. Because like with a heart attack, with a stroke, time is tissue. And the quicker you can get to a healthcare facility, the possibility of you being treated, possibility of that stroke being reversed is there.
Interesting you talk about a heart attack. Is there any similarity between a heart attack and a stroke?
Yeah. So the main similarity is the pathophysiology, or the way the disease happens,
Right.
and the risk factors that are associated with that. So if you think of heart attack, it's high cholesterol, it's obesity, it's diabetes, it's hypertension, which is one of the main ones in our country.
So in terms of how it occurs, it's one of the arteries getting blocked,
Yes.
as you have in...
Yes.
Okay. And what about hemorrhagic?
So
Or the bleeding.
with hemorrhagic strokes, the biggest risk factor is hypertension.
Right.
And in our country, you know, I agree with Prof, while we don't have accurate stats, the estimates are that 1 in 3 people in South Africa are potentially hypertensive.
Okay, we're going to come back to causes and risk factors just now. But perhaps let's go back to Cape Town and ask, you know, Prof. David, in terms of, we heard clinical signs and symptoms and so on, but what is the natural cause? I mean, is someone who's just had a stroke, what does it mean? What happens over time?
Well, that depends on whether the blockage, it depends on where the blockage is, and it depends on what happens to that blockage. So if nothing happens, that person might be left with quite a severe neurological deficit. In other words, they might have no recovery at all. Certainly, we know that the part of the brain that is being supplied by that blood vessel might die, but the part of the brain around that blood vessel might recover. And that's why we see recovery in patients, because the body does eventually dissolve the clot, and the part of the brain that was ischemic, in other words, wasn't getting enough blood but isn't dead, might now get enough blood and recover. If that makes sense.
All right, okay. So I mean, just now we said that a third of those that get strokes unfortunately die. Is that the normal course of events, or is there something that, you know, can be done to reduce, as it were, the rate of people that die from strokes?
So as we know, in stroke, time is brain.
Yeah.
So to put things into perspective, let me tell you, so in Switzerland and Germany and in the UK, they've now got ambulances with CT scanners in the back of their ambulances. And if a call goes out for a patient who's possibly having a stroke, that ambulance will be dispatched. And what will happen is they'll pick the patient up and they will do a CT scan when they stop at a robot, because the CT scanners are so fast nowadays, and they will see whether the patient's had a hemorrhagic stroke or whether the patient's had a blockage to one of the vessels. Because if there's no bleed, then they will actually start the drug that dissolves the clot as soon as possible.
All right.
So that the area of brain... So,
okay, that's fine. Hopefully we'll get to that point in our country at some point. But for now, we just need to go for a quick commercial break and address the issue of what causes these strokes and who's at risk. Then after the break, please stay with us.
At Medfield Medical Scheme, we don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est si bon.
Medfield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
On Network, we tell you about Africa's social media and technology landscape. 21st century economies rely on technology to truly thrive.
We have quite a comprehensive portfolio of interventions in the tech entrepreneurship space.
And Africans are using tech and social media to solve the continent's unique challenges.
App Nigeria is an online marketplace.
Radio Vibe is a social media platform for radio music.
That's Network with me, Pumelele Zondi, every Sunday at 7:30 p.m. Central African Time.
High blood pressure, medically known as hypertension, is a major risk factor for heart disease like stroke, kidney disease, and even eye diseases. When your blood pressure exceeds a certain threshold, we call it high blood pressure. Unlike many other diseases, hypertension has no symptoms, and hence it is called the silent killer.
In actual fact, high blood pressure is asymptomatic. That is why we call it a silent killer. There are other contributory factors that can make you think that it's because I'm sure my blood pressure is high. We do get some dizziness now and then. It's not actually a symptom as such. So with high blood pressure, you need to have it checked. Then we can say, this is your blood pressure.
According to the World Hypertension League, 4 in 10 adults older than 25 have hypertension. The unfortunate part is around 50% of these people are unaware of their condition. Of those who are aware, half of them do not take any action to control their blood pressure, either through lifestyle modification or medication.
What I know about high blood, it's caused when you're overweight. A weight factor has got to do with the high blood. To maintain your high blood, you have to exercise maybe 3 times a week, and you have to control your diet.
I eat good food. You must eat fruits. You must eat vegetable in order to control it the right way.
The good news is that blood pressure is easily measurable without any discomfort. And once you know you have elevated blood pressure, you can do something to prevent and control rising blood pressure and thus avoiding potential risk.
Untreated high blood pressure can lead a lot of people into a serious problem. And we take it very mildly. The complications are like the eyes. We get things like the pupil edema of the pupil of the eye. The macula also gets affected, and at the end it's the sight.
Everyone can take steps to minimize the odds of developing high blood pressure and its adverse consequences.
Now, before we talk a lot more about, risk factors, causes, and in particular high blood pressure, let's take Hamzi on the line from Johannesburg. Hamzi, welcome to Health Talk.
Good morning, doctor. It's Mrs. Arons.
Mrs. Arons, yeah?
Yeah, my question is, doctor, I am a known hypertension patient, okay?
Yeah.
And I'm on Cosacom at the moment.
Right.
And I was on Bilacor.
Yeah.
The problem is, doctor, that when I'm on both the medication, I become so dizzy. And there was many a times that I just fell, and it concerns me because I went back to the doctor, and the doctor said I must decide for myself because my blood is at the moment under control. I don't eat oily stuff. I don't have salt in my food, nothing at all. So at the moment it's like 102 over 68, 70.
Right.
And I'm concerned because I need to know that do I stop the Cosacom and
Okay.
what am I supposed to do?
All right.
Yes.
Thanks for your question, Mr. Haramse. I mean, this is, perhaps you can take this. I mean, it shouldn't be. Clearly, there's one thing about controlling high blood pressure, but side effects need to be taken care of.
Yeah, so I think the important thing is to actually have that discussion with your healthcare provider.
Right.
Discuss what you're experiencing. It's never safe to just stop medication because you're experiencing a side effect, because obviously you're on the medication for a reason.
Yeah.
And if your blood pressure was high initially to have put you on that medication, maybe the doses need to be adjusted. Maybe the frequency needs to be adjusted, or maybe the tablet itself needs to be changed if the side effects are too severe.
Sure, and we have a myriad of high blood pressure medication,
Absolutely.
and it's a simple discussion
Yes.
between the... Okay, let's go over to Cape Town and speak to Prof. David Lefevre. Now, Prof. David, let's talk about risk factors now, and in particular risk factors for hemorrhagic strokes.
Okay, so with regard to hemorrhagic strokes, the biggest risk factor is hypertension.
Right.
So it's important that people have their hypertension treated. It always amuses me how people go into antihypertensive and they say, no, my blood pressure is normal, so I'm going to stop taking my drug, which is obviously wrong. But the risk factors for all strokes, we can divide into modifiable and non-modifiable. Right. So, you know, if you're a male, you can't change that. If you've got a family history, you can't change that. But if you smoke, if you're diabetic, if you're overweight, if you're hypertensive, those are the modifiable risk factors that in which we like to intervene. Obviously, cholesterol as well.
What about age, though? You know, when in my introduction, I said, obviously, it's, you know, it's common in people over the age of 60, but you do see strokes in younger people, isn't that so?
Certainly hemorrhagic stroke, you know, subarachnoid hemorrhages occur in people in their late 20s and early 30s. We're seeing more and more younger people having hypertension. They're at risk of having a hypertensive bleed. There are various diseases. HIV has, you have strokes in HIV patients, so we are seeing stroke in younger patients. So it's not something that is just limited to older, what we perceive as older people.
All right, Dr. Matara, in terms of, let's carry on the discussion on, you know, causes and risk factors and so on, but perhaps for more embolic type of strokes.
Okay, so essentially the same risk factors that would give you a heart attack. So diabetes, hypertension, obesity, high cholesterol, smoking, excessive use of alcohol. As Prof said, HIV to a large extent in our younger population is a major risk factor. People who've had mini strokes before, what we call a TIA, are all at increased risk, and it's simply things like atrial fibrillation, which is where the heart's quivering and not pumping properly, which causes pooling of the blood and little clots then shoot off into the brain. So, you know, those are all things that can, as Prof said, be modified.
But all these conditions, yes, you talk about being modified. I mean, it's not the fact that you have hypertension that you'll necessarily be at risk, but it's if you have uncontrolled.
Uncontrolled, absolutely. So if any of those risk factors are not managed, you know, you don't exercise, you don't eat correctly, you smoke excessively, those are things within your power to control.
In the clip that we played earlier, we showed someone that said, you know, he got a stroke because of abuse of recreational drugs such as heroin. Your comment on that?
So we do see those. Often what happens is because of the intravenous use, they get infections which can seat on the valves in the heart, and those then shoot off and cause what we would cause an embolic stroke. So yes, we do, but you know, it's sort of limited to a particular group of people who do abuse drugs.
Prof, in terms of the split between hemorrhagic and embolic type strokes, which ones do we see more often?
So we see, or as a neurosurgeon, we see most of the hemorrhagic strokes, but certainly within our hospital, most of the strokes that we see are thromboembolic. You know, that is the most common. 85% of strokes are thromboembolic. Of the patients, though, with thromboembolic strokes, very few of them make it to hospital in time quickly enough to be treated.
But what should be the trends? I mean, yes, 85, you know, 20 split in terms of embolic and hemorrhagic. Should it be the kind of national, I mean, you know, standard sort of split, or should we be seeing less of the hemorrhagic ones?
No, I'm not too sure about that, actually. You know, all I can do is talk about what you see here in the Western Cape, and I'm sure Feroza will say the same.
Okay.
No, I think I agree with Prof. I think it's pretty much the same kind of split. The majority are embolic, thromboembolic. I think a lot of it is related to the fact that it's largely a lifestyle illness. And, you know, we're steadily becoming a very obese nation. A nation that has 1 in 3 people, as I said before, with hypertension. I mean, if you average that out, it's about 6.3 million people in South Africa that have hypertension.
I guess that was the rationale behind the question, to say, because these are lifestyle-related type issues, you know, what are the trends? Are we seeing an increase, or should we be seeing a decrease rather than, you know, having to deal with this kind of thing?
We are definitely seeing an increase. I mean, you just have to compare our rural populations to our urban population. In, for example, Johannesburg, the risk factors for all those lifestyle illnesses, the alcohol, the smoking, the obesity, are increasing. And the worrying thing is that it's happening in our school kids, in our children. And, you know, they're one of the reasons why we're seeing more and more younger strokes.
Yeah, very worrying indeed. So I guess on this point, perhaps let's go for a break. And when we come back, we now learn about how we can prevent these strokes. Stay with us.
If we're talking health, then let's talk seriously. MedShield, embracing our members in good health since 1968.
Yeah, it's more of a validation. You know, it's more of like, okay, you're on it. Because it's been a dream and a goal from the beginning, like to get here.
The fact that the rest of the world is actually acknowledging the amount of work we put into, you know, into music as Africa as a whole, I think it's fantastic. It's a big one for South Africa too.
The School of Ballet in Nigeria has changed many a mindset in dance.
Saw it a lot on TV and we looked at it like something that probably could not be taught to us because we thought it was like a white man dance or probably something it's their culture now, but it actually taught me that it's not just about culture because dance is a language.
For more arts and entertainment news, catch Trends every Saturday from 12 to 1.
Welcome back. We're talking stroke, and in this segment, we're going to be talking about how to prevent stroke. But before we get into the discussion, let's take Kathy on the line from Cape Town. Kathy, hello, and welcome to Health Talk.
Good morning. I have an issue in the sense that I've been diagnosed with being hypertensive from the age of 40. I'm now 60 years old, and about 2 months ago, I have been diagnosed as suffering of severe sleep apnea. I'm now on the CPAP machine, and I've picked up that my blood pressure is, I have a machine that I monitor my pressure at home, and I've picked up that my blood pressure is dropping, so much so that I'm not taking the medication now for the past, I think, 3 days, 5 days. I'm trying to monitor it so that I can go to my GP and ask whether I should come off the medication or should I still continue it. I mean, as for example, this morning, my pressure was 117/82. So I'm just wondering, without taking medication, so should I still continue on with medication or should I just stop it?
If I were to answer you, I'd say that's risky, but let's hear what the experts say. Dr. Butara?
As I said earlier, I think it's very risky to just stop your medication. The fact that your blood pressure is 117/80, which is near textbook blood pressure, is a good thing. Right. And possibly, you know, the antihypertensives have helped get it there. But you stand the risk of having stopped the treatment for it to go up again. And, you know, obviously without even realizing it. The good thing is that Kathy's monitoring her blood pressure, which is, you know, good for her.
All right.
But I think she should speak to a healthcare provider
to a doctor.
about it, yes.
All right. I believe we have Tandi from the DRC. Tandi, welcome to Health Talk.
Thank you, Doctor. Good morning, doctors. I just want to find out, I was diagnosed with embolism. So I was on warfarin for the past 6 months. So I'm off now. So I want to know if are there any chances of getting it again?
Okay, where was the embolus coming from?
From my leg.
From your leg, okay. Thank you.
Yes, I had an operation, a major operation just before that.
Okay. Excellent question. Perhaps let me direct this question at Prof. Lafiva in Cape Town. Prof, you heard the question?
I heard the question. So I presume she had a deep vein thrombosis.
Correct.
And the reason to go on heparin is to stop the thrombosis from breaking off and going up into the lung and having what we call a pulmonary embolus. So she should stay on the heparin. And depending on whether the thrombus was above or below the leg, if it's below the leg, sometimes some doctors take patients off the heparin or the warfarin. And some physicians believe that you should stay on the warfarin.
And lifelong, is that the case?
Yeah.
Okay. Perhaps let's stay with you a bit and talk about, I mean, we've spoken a lot about causes and risk factors and so on, and staying on that subject of saying, you know, how can we prevent strokes? Obviously, this was a classical case of someone who's had a DVT or deep vein thrombosis before and staying on these warfarin-type tablets on a lifelong basis. What are the other kind of things that people should be aware of that and should do to try and prevent strokes?
Okay, so I think we've covered some of them. So if you're hypertensive, you need to have your blood pressure monitored and you need to have your blood pressure controlled. If you're diabetic, you need to have your diabetes controlled and monitored. You need to stop smoking. You need to follow the correct diet. You need to exercise. If you're hypercholesterolemic, you need to have your cholesterol under control. And these are the things that you can do to reduce your risk of having a stroke. Sometimes, as Feroza was talking about, atrial fibrillation. If you have atrial fibrillation, sometimes you have to go onto warfarin. There are ablations they can do to try and stop the heart from fibrillating. So it does depend on what the cause is, but there are things that we can and do try and do to decrease the risk of having a stroke. Interestingly enough, if you have atrial fibrillation and you go onto warfarin, you have a slightly increased chance of having a hemorrhagic stroke. But the risks are still, you're better off being on the warfarin and risking having a hemorrhagic stroke rather than a thromboembolic stroke.
What about other, I mean, we've heard of recreational drugs, but, you know, you do find people that will take all sorts of stuff, and perhaps in the sporting world, you see quite a lot of, you know, abuse of supplements and all sorts of other drugs. Your comment on that?
Yeah, I don't know if I can comment. I'm not aware of it. You know, we don't see, with regard to recreational drugs, you know, it's people who take cocaine and heroin and stuff like that. Yeah. But with regard to the drugs that people use to augment their sporting capabilities, I'm not sure. I can't pass comment there.
All right. Let's get a comment from Dr. Mutara. I mean, we've spoken a lot about hypertension, but I think, you know, it doesn't have much to re-emphasize the importance of hypertension. Your comment on that?
Absolutely. I think because it's such an important facet of South African life, and our black population in South Africa are particularly at risk. So, for example, black females in South Africa have the highest stroke rate, and the majority of those patients are as a result of hypertension that's not controlled. And because, as Prof was saying, you know, the fact that it's a silent illness, basically you've had it for years before you actually develop a symptom which will alert you to say, okay, I've got something wrong, let me go to my doctor and go and check, and then discover. But you've had it for years previously where it was causing the damage. So I think it's I mean, you just look at figures, 1 in 3 have hypertension. It's costing our country billions every year to treat patients as a result of hypertension, and they're not just at risk for stroke, they're at risk for a heart attack as well.
Okay. All right, let's take Sibusiso from Soweto. Sibusiso, welcome to Health Talk.
Hi, Doc. So I have family history of both my dad and my mom. You know, there's people who actually had strokes, multiple strokes.
Yeah.
And my dad actually passed away from having a headache and whatnot. I just want to know, what can I do to prevent it and not necessarily fall victim to the same, you know?
Okay.
I mean, you've spoken about not smoking. I don't smoke. I don't take recreational drugs, but I'd like more information.
And you don't have hypertension or heart disease or?
I do actually, but it's under control. I monitor on a 6-month basis. So twice a year I go in for a checkup, and you know, because it's free at local clinics.
Great stuff. Well, here's somebody who seems to be doing quite well.
Wow, absolutely. Yeah. And the fact that he's aware of the risk factors means that he's dealing with it. You know, exercise, proper diet. He doesn't smoke. You know, he's obviously aware of it. And the fact that he knows that he's at risk is an important factor.
Right.
You know, you can't, as Prof was saying, it's one of those non-modifiable risk factors. You know, you can't do anything about your genes.
So he's doing quite well?
He's doing well.
I
think he needs to just carry on monitoring it, yes.
Right. Okay. Perhaps before we go for a break, and let me just say thank you very much to Prof. David Lefevre, Consultant Neurosurgeon, Groote Schuur Hospital and UCT Private Academic Hospital in Cape Town. Prof, thank you so much for your time.
Absolute pleasure.
All right. So we're going to go for a quick break and, address the question of saying, so what happens when you have a stroke? I mean, okay, what do you do in that time that you recognize the stroke? And, what chances are there that, there's good support for people who have survived the stroke? That after the break. Please stay with us.
At MedShield Medical Scheme, we don't just talk health, we do health. MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well. If we're talking health, then let's talk seriously. MedShield, embracing our members in good health since 1968.
News Today provide news updates giving a wealth of knowledge. Breaking stories and crossing live for you. We follow business developments intensely. Experts and analysts tackle all challenging issues for you. We cover stories locally and abroad to keep you informed. We cover all sporting codes just for you. We are sure to give you weather to be ready for the day. Stay tuned to News Today at 3 p.m. from Monday to Friday on SABC News.
Litlogonolo, also known as Nonu, was born in 1992, Pretoria. She attended her first high school at Christian Brothers College. As time went by, she ended up having a stroke during her matric year. She spoke to us about her experience.
It started out with the fact that I was in matric and I was 17 years old. I was at school. And it was the first week of February 2010. And we were having a choir workshop. So as we started warming up, that's when I started feeling like something wasn't right. So I ran out and my friends ran after me.
Litlogonolo suffered and had to undergo an operation. After her operation, she wasn't able to do much. She couldn't walk, talk, or feed herself. The stroke impact was too much to bear. But today, that seems to be a distant memory.
When I think about that question, for me, it seems as if it's something to do with how I handled change, because I had to go through so many changes in my life.
Many stroke survivors improve over time, sometimes over a number of years. Recovering from stroke involves making changes in physical, social, and emotional aspects of your life. With the support of her family and friends, she was able to do more for herself in just a period of 6 years.
I've been getting quite a lot of support from my family and my friends. They've been really supportive since day one.
Her biokineticist, Caitlin Griffiths, who worked at the University of Pretoria Institute for Sports Research, spoke to us about the process of recovery.
The recovery process obviously depends on the type of stroke a person goes through. So, for example, there's different symptoms that a person can have after a stroke, such as physical symptoms, such as emotional symptoms, such as just general fatigue or weakness or anything like that. So the recovery process depends.
As someone who spends more time with stroke patients, Kaylin explains how exercise plays a vital role in terms of recovery.
Exercise helps to increase recovery in the terms of it helps the added comorbidities that is relate to stroke, such as hypertension, high blood pressure. Exercise helps to decrease that, which in turn decreases your risk to having a stroke.
Today, Nono encourages people not to let anything get in the way of their goals and not to let something like a stroke make them think that they can't reach their goals.
Okay, welcome back. Well, now, treatment and rehabilitation of strokes, often involve a multidisciplinary team of experts. As we heard, we have Dr. Feroza Mutara, emergency medicine specialist from Wits. And we just heard, from Cape Town studio, we had a neurosurgeon. Now, it's a great pleasure to welcome on studio other members of this multidisciplinary team. First up is Megan Bunce. Megan is a speech therapist based at Rehab Works at the Life Groote Schuur Hospital in Pretoria, now formerly known as Little Company of Mary. Welcome to Health Talk.
Thank you very much.
Right, and next to her is Nikki de Beer from the same institution, Rehab Works, Life Groote Schuur Hospital. And Nikki de Beer is an occupational therapist. Welcome to Health Talk.
Thank you.
All right. Before we carry on our discussion, let's take Paula on the line. Paula, welcome to Health Talk. Gail.
Good morning, Doctor. How are you today?
Good, how are you?
Fine, thank you. Doctor, I'm in primary health, occupational health.
Yes.
And this is concerning stroke. I lost my mother-in-law at 48 because of a stroke.
Right.
So I've got one of my employees that works for us. He was on antihypertensive treatment. He was given his treatment, and at the hospital they gave him his treatment, but it was a different dosage to the previous.
Yeah.
Say he was on 100 milligram atenolol.
Yeah.
They gave him 50, but they did not tell him take 2 tablets instead of 1. So he continued taking his dosage, and he was underdosed, costing him to have a stroke and losing his job. So I feel they are not explaining nicely at the hospital to these people as far as the dosages are concerned for high blood pressure. And I've got a respect for high blood pressure, doctor.
Yeah. Well,
thank you very much.
Well, thank you very much for your call. A very worrying one, Dr. Mutara. Your comment.
Yeah. Look, I think generally we don't talk to our patients enough. And one of the most important things to do is, as Gail says, is, I'm changing your medication. Please note the dose is lower. You need to take 2 tablets. And if that kind of discussion doesn't happen, then we're falling short of what our responsibilities are.
Yeah.
I think it's a very worrying concern.
And also just make sure that even when we talk to our patients, they can fully follow what we're saying.
Exactly.
And
Yes,
they
that it's
understand,
explained to them in a way that they understand, or possibly even in a language that they understand. Our elderly patients don't all speak English. So it's important, if you need to get an interpreter to get them to understand the implications.
And of course, the consequence, can be quite ghastly, as in this case. Yeah. Anyway, let's get back to our subject. Perhaps let's start, at the early stage. How can people recognize that this person is having a stroke, and what should they do in that instance?
Okay, so as David said earlier, there are treatment modalities, both for an ischemic and a hemorrhagic stroke. The problem, though, is that we're seeing the patients too late. So if you recognize any one of those fast symptoms...
Yeah, let's just go over them again, just for completeness.
Okay, so F is for facial droop, and you ask the person to smile or show me your teeth, and if there's a droop on one side of the face, that's a sign. A is for arms, so lift both the arms if there's a droop or they're unable to lift one or both of their arms. Speech is a big one, and I'm sure we'll hear about that again. And then time is the last letter of that fast.
Yeah.
And that is crucial because, especially for an ischemic or an embolic stroke, if we get patients within 4.5 hours of them having developed the symptoms, there is a possibility that we can reverse the stroke with medication that can dissolve a clot. So, but beyond that, it becomes more and more difficult because, if you think about it, there's a stat that says 12,000 cells, brain cells, are lost every minute that you're not treating it.
Okay, so the important thing is be able to recognize that there's something happening.
And get there quickly.
And get to hospital quick. Okay. Now let's understand from our two guests. Let's start with you, Megan. Perhaps tell us a little about, what actually you do at Rehab Works. And I believe that you get involved as this multidisciplinary team from the moment that the patient gets to the hospital. Take us through what you do.
That's right. So we see patients from day one.
Right.
Within the first 24 hours, a speech therapist has to see the patient. And that is primarily for swallowing problems.
Yeah.
Over 50% of patients with a stroke are struggling to swallow. And the consequence of that is that they aspirate. That means the fluid or whatever they're eating is going to the lungs and not to the stomach. And that increases your mortality rate. So it's very important that patients who are choking or struggling to swallow, that we intervene. So if they can't eat, the alternative would be to put a nasogastric tube in until we can get them to eat. And patients eat again. Right. It's just important that we manage it so it's not an extra complication. Going to getting pneumonia, ICU, mortality.
Right.
So that's very much our first point of call as a speech therapist.
Let's just stop here and take Alistair on the line from Cape Town. Alistair, welcome to Health Talk.
Good morning, Doc, and good morning to your panels. I would just like to ask your doctors, in 2011 I had an aneurysm.
Yeah.
And 3 days later I had the operation. And then 4 months later, I had a very big seizure. I would like to know if I will have another aneurysm and what are my chances of a stroke.
Yeah. Well, are you on any medication currently?
3 years later, they took me over the medication because I'm quite normal.
All right. Dr. Mutara, your comment?
Okay, so look, if you have an aneurysm, it's an inherent abnormality in the blood vessel wall. I'm sure they would have done scans and angiograms at the time to determine if there were others in the area.
Yeah.
Having corrected that, there's no guarantee that you won't have another aneurysm, either in the same place or in another place. And obviously, he'll need to follow up and make sure that he has checkups and whatever underlying issues there were that need to be controlled are managed as well.
So the idea is that he must continue what he's doing now, you consult on a regular basis and just make sure that, he...
Absolutely.
All right. Let's bring you in, Nikki. From your end, what role do you play in that sort of environment of someone with a stroke?
Like Megan said, it's a team approach. So with the physiotherapist and the occupational therapist, we will go in within 24 hours. Depends on where in the hospital the patient is. If they've had a big stroke, they'll be in ICU. If they had a smaller stroke, they'll be in a general neuro ward in our hospital. And we will evaluate them. So we will go in and see what happened to them and what are their deficits at that point.
Okay. So rehabilitation obviously is a long-term thing. It takes quite a long time. Just take us through, I suppose, we have just a few minutes left, but just take us through essentially what you do over that period.
Okay. So my role would be to look at somebody getting independent again. So one day they're fully functional, the next day they had a stroke and one side of their body doesn't work, or they can't think straight, or they can't speak, or they can't, if they look at something, they only see half of it. So we would look specifically at the patient and see what are they struggling with and work on that. We work in the acute setting, so we've only got a specific time, usually in our hospital 2 weeks. If they're medically stable, then they move on to the next hospital, which is a rehab phase. So
but there they continue exactly the same
They continue
thing.
and our focus is a lot with medical patients still. So they're still medically acutely ill.
Yeah.
So the doctors have a big role and we have a big role, but then they move on to the next phase, getting them independent, back to the community, back to work, back to driving, whatever is possible.
In terms of speech therapy, long term?
I think speech therapy is always longer. If the hand is affected and the arm is affected, it takes longer than walking. But I think what's important is that it's what we do. We adults and we humans and we speak. And so we want to integrate patients back into society, get them talking, teaching their caregivers or their significant others to also communicate and be the crutch for them to participate in life.
I suppose the message in this segment was that, look, get somebody to hospital as soon as possible to increase chances of survival. And that once you're there, there's hope.
Absolutely.
Through actions of people like you, isn't that so?
Yes.
Oh,
Some of the
I just so
stats-
wish we had more time to discuss, but unfortunately we've run out of time. Dr. Feroza Mutara, Head of Emergency Medicine, Wits University, and, well, shall I say academic Head of Medicine, you know, Emergency Medicine, Wits University, and Head of Emergency Unit at Charlotte Matlaka. And Megan Bunch, Speech Therapist, Nikki DeBeer, Occupational Therapist, both from Rehab Works, live Groote Schuur Hospital. Thank you so much for your contribution, ladies. And I just wish that we had more time, but I'm sure there will be more opportunities later on. So, folks, it's on that note that we come to the end of our show. Remember, stroke is preventable and treatable only if you act fast. Okay, well, that's all we had for you today. Remember, you can join us again next week on SABC News same time. And please remember to share your views and comments with us via our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. Remember, today's show will be repeated at 2 o'clock in the afternoon and again on Thursday in the morning. I'm Dr. Salome Daung. Thank you so much for watching, and please do take care.